All right, as COVID cases continue to climb in China, the U.S. will require all travelers from that country to show a negative COVID test or proof of recent recovery before being allowed into the U.S. This new rule goes into effect 1 week from today. Now, the new restriction comes as China is now allowing residents to once again travel abroad. It's part of its move away from its zero COVID policies. Let's bring in Dr. William Schaffner. He's a professor of infectious diseases at Vanderbilt University Medical Center. Dr. Schaffner, appreciate your time here. China quickly ended a lot of these zero COVID policies. Hospitals are now being inundated with sick patients, and the surge is not expected to slow down in China. Is the country still making the right decision in getting rid of some of these restrictions?
Well, they've made those restrictions for better or worse, Gerard, and they've made them very, very suddenly. And that's in part why the country is not as prepared as it ought to be. But the point about the travelers is important. Now, we have a lot of COVID here. These travel testing requirements are not to keep COVID out. We're concerned about variants. You see, when there's so much multiplication of the virus in China, that raises the chance, the statistical chance that a new variant will crop up there. And unfortunately, the Chinese are not explaining this to the rest of the world. They're not giving us the genetic information about the strains there. So if a new, really bad variant showed up in China, we wouldn't know about it. One of the things we can do is test everybody who comes in to try to give us a little more time, should a variant appear, for us to respond.
You know, I mean, that leads right into my next question here. How significantly can COVID testing of travelers from China reduce the spread here in the U.S., or is it potentially too late at that point?
Yeah, it's not so much reducing the spread here. It's trying to give us an early alert about a variant. If there's a variant in China, by having this testing procedure in place so that everybody's negative who comes in, it will give us more time to prepare if a variant shows up that our vaccines don't work against. We wouldn't want that. We would want as much time as possible to create a new vaccine and to educate the public about the new danger.
Gotcha. You know, one question that I have been asking almost every doctor I've talked to over the past 2 or 3 years now, how long is COVID going to be with us in a real significant way? We're seeing hospitalizations here in the U.S., but not nearly the numbers that we saw a couple of years ago. What's the scene right now?
Well, Gerard, the scene is that COVID is here. It's not going to disappear. We're going to have to learn to cope with it. We likely will be vaccinated periodically. The vaccine will be updated the way we update our influenza vaccine. So we're going to have to live kind of in a truce with this virus. It's not just going to disappear. It's still causing around 300 deaths in the United States each and every day.
I think that's something a lot of people forget about, that this still is impacting a lot of people. Dr. William Schaffner, thank you so much.
Thank you.